Welcome everyone. I'm Councillor Matthew Williamson, Cabinet Member for Community Wellbeing, Health and Care. Welcome to the decision-making meeting for Community Wellbeing, Health and Care at Portsmouth City Council. Just some housekeeping first. If the continuous fire alarm sounds, please evacuate the room and public gallery by the stairwells. Do not attempt to use the lifts. Please assemble by Queen Victoria's statue in Guildhall Square. In order to comply with the Guildhall Trust fire marshal regulations, anyone who signed in at the Guildhall reception desk should sign out when leaving the building at the end of today's meeting. There's no members of the press or public here, so I won't mention that. Please go everyone use the microphones and remember to switch them off when they have finished. So I'll just go round the room and ask for introductions. Anna, you start with you.
Anna Martin, Democratic Services.
Louise O'Sullivan, Adult Social Care Group Accountant.
Andy Biddle, Director of Adult Social Care.
Simon Nightingale, Associate Director for Health and Care Services.
Councillor Graham Heaney, Labour Group Spokesperson for Community Wellbeing, Health and Care.
Councillor Lewis Goslin, Conservative Spokesman for this board.
Thank you very much everyone. We have no deputation requests. We have two apologies for absence, Councillor Brian Madgwick from Portsmouth Independent and Councillor Kirsty Miller from Portsmouth Community Independents. Colleagues, any declarations of interest? No? Brilliant. Without further ado then, over to Portsmouth Health and Care Discharge to Assess model. Over to you, Simon. And Andy, whichever way you want to do it.
Thank you. So we brought this paper today to give you an update on our D2A arrangements, discharge to assess from the hospital. We've been running this scheme for all the way through COVID, and since the end of the hospital discharge funding arrangements, we've been working with our ICB colleagues on a local scheme. This sees people that no longer meet the criteria to reside in the acute hospital go home or go to a home, temporary placement, whilst we then assess for their ongoing needs. We brought previous papers, so I'm going to use data as of the end of June as an update. The figures I'm going to quote do change quite rapidly, so this is as it was in June. So as of June, we had 61 residents within a temporary arrangement, 34 individuals in care homes, 61 at home. Our D2A model assumes 10 residential placements, so we are using more placements currently than we are forecast to use because of demand, because of the ability and speed of which we can get to folk to onward assess. However, we are seeing more people go home presently compared to those being discharged to a temporary placement, which is a good thing. However, as I say, we can't get to those folk quick enough, which means we've got more people waiting over the 4-week agreed funding limit, which is putting a pressure on social care budgets at this time. That's driving us to be concerned about how much longer we'll be able to manage and operate this scheme. That scheme talks about 1.7 mil funding from the ICB to enable us to operate this D2A model. Based on the current activity, we believe that will be used up by the end of this calendar year. Therefore, we are focusing on more home first and really challenging our colleagues and ourselves when we're at the hospital to take an appropriate level of risk when we're helping people to go back home with packages of care and other support within the community, and trying to focus our D2A beds and spot placements only in the most complex of cases. We have a gap in our assessment capacity presently, so we're trying to fill those in different ways through working differently with other colleagues and other services. We're also making sure that we're using our bedded capacity appropriately. So when there are residents who are homeless, either street homeless or have other homeless issues, we're working with our other council colleagues to make sure that if there are other arrangements and other access to services, then they're being considered as well. So we're not just using D2A for absolutely everything. And we're also looking to further reduce the length of stay within our Jubilee unit. That has increased recently, the length of stay there. But again, due to capacity within the assessment team and due to not always taking the right criteria, the right cohort of patients, but that is coming down. As we get to the end of summer, or when we get to the end of summer, we will be firming up our plans for winter, which will include preparation for how we're going to manage D2A over the winter period. There's no confirmation of additional funding, but as we know in previous years, there is likely to be some, although we can't take that for granted right now. If there is additional winter funding for D2A or for any health and social care needs, then we'll look to see how best we can support our D2A arrangements to get us over the winter period. So happy to take any questions.
Thanks, Simon. Andy, did you want to add anything additionally?
Thank you, Chair, and thank you, Simon. I think it's worth focusing on the fact that we've achieved a lot in Portsmouth, working in conjunction with Solent NHS Trust and Hampshire and Isle of Wight ICB locally, and that the Jubilee unit is a real success. It's run by Solent NHS Trust, but it also has staffing that were transferred from the City Council, so it's very much an integrated operation. I think discharge to assess has been difficult. It was introduced during COVID with a fund that had more capacity to it than local funding, than the discharge grant that we've subsequently seen. And so that's what's putting us under a bit of pressure, I think, to achieve, because in effect we're seeing people come out of hospital far earlier. They can have more intensive needs as a result of that. And local arrangements can only manage so much, can only moderate so much in that respect, I think. As Simon's highlighted, we do have some work to do locally. It's not it takes us longer for any of our residents who have housing issues or who are homeless to go through the reablement pathway than those that are returning to their own home or moving into a care home. So we've got some work to do with our housing, neighbourhoods and buildings colleagues, as Simon reflected. There's support for that from our HMB colleagues, and everyone's keen to get the right outcome for our residents in that respect. But there are some significant issues still with discharge to assess that we haven't managed to iron out to make it the perfect system, if you like. So there's a funding issue and there's the needs of the people that are going through that process. Thank you, Chair.
Thanks, Andy. Any questions, comments? Lewis?
More of a comment than a question from me. Just to say, and kind of back up Andy's statement of, obviously this has been a journey, but actually it's been a very successful journey. So last week at the LGA conference in Bournemouth, actually had colleagues from around the country come up and ask and inquire about our DTA processes, because it is known nationally for successful, and I think it's partly due to that integration that we've built up over so many years, that actually when COVID hit and this new scheme come in, it wasn't a newfangled world for us to be working with NHS colleagues. So it just shows that all of that work over such a sustained period has really paid dividends to us. And I think Andy's kind of hit the nail on the head that the next bit to really tackle is actually integrating with the housing department and seeing what better links we can get there, because it's not just people that are homeless or having housing issues. There's a lot of backlog in the system when people actually do want to return to their own home, but their own home might not be in a suitable condition for us to get them back into. So if we can iron out some of those creases in the coming months, ready for winter, then actually we'll be in a pretty good place. So, but well done everyone from me.
Thanks, Lewis. Graham?
Yeah, I have a couple of questions, really. The first one I was going to is probably quite difficult to answer, I suppose, but I understand from what Andy was saying is the discharge to assess process is basically seen as quite a good thing. Are we sure it's creating better outcomes for the people who go through it? Can we actually demonstrate that? And are the problems really around the adequacy of funding and some of the other arrangements around the edges that we've talked about? Is that really where the problem's coming from? It's basically a good thing to do, but we're short of money and we've still got some wrinkles in terms of the relationship. Would that be a accurate assessment?
Yes, I think so. I mean, in terms of outcomes, it's really difficult to measure outcomes. One of the only clear measures we have is something as part of the ASCOF, the Adult Social Care Outcomes Framework, which is data that we submit yearly to national government, where we talk about people that were in their own homes 3 months after experiencing reablement. And it's a very similar thing with discharge. We want to get people back home. We want people to stay in their own homes. We want to make it sustainable. So I think in terms of outcomes, we are seeing more people go home. There's various national targets for those people that leave the hospital without any support whatsoever, those people that might need a bit of domiciliary care, those people that might need reablement, those people that might need care home accommodation. And we do well on those targets in Portsmouth in terms of our residents that come out of the hospital. The vast majority of them do go home. I think we've had some work to do, and Simon hinted at it in the paper, in working with our colleagues who work directly with discharge, who are helping these people leave hospital, quite literally, in making sure there's better understanding and knowledge of the amount of domiciliary care that we can put in for people so that they can avoid a care home placement if they need to. So that's a piece of work we do need to do. I think we generally agree that discharge to assess is the right thing to do because it means that people spend less time in hospital. And we know we've seen research over the years that talks about that people lose muscle function and they lose independent abilities the longer they spend in a hospital bed, because a hospital isn't an environment that's necessarily geared to get people up and out and moving, whereas a reablement environment in the community is. So I think it still is the right thing to do. I think the difficulty is generally we haven't put in, as a society, if you like, we haven't put in the foundations to make discharge to assess per se a success, because we haven't got a national plan for it with national funding and pathways, etc., etc. So I think that's the difficult thing. We've got lots of local arrangements up and down the country, and if we really want to make this an embedded success, then we need to think about prevention. We need to think about where we spend our NHS money. Which has been talked about in numerous reviews in recent times about where does the budget for the NHS sit. We've been very successful locally. It's not enough to sustain discharge to assess, I think, in my view. It is still, I think, the right thing to do. Ultimately, of course, we'd actually rather see far less people going to hospital, working on admission prevention. And there is a lot of work around admission prevention, but we'd really like to see a sea change so that we've got very, very responsive services, more so than currently, that can keep people out of hospital when there's a risk of them getting there. That's a bit of a long answer, but I hope that gives some context.
I understand it's a difficult question to answer, but I think to be reassured that it's not the actual model, if you like, we've got to just it's the problem. It's the way it's actually supported and so on. I suppose one thing that one could look for, instead of a government, whichever government it is, imposing some sort of thing from outside, we can actually build on the experience that we've had locally from different local authorities to try and build a system that could be applied more widely across the country. That would be my sort of view of it. I'm a great bottom-up person rather than the top-down person. So I did want to ask another detailed question about the financing, and maybe it's a bit of a quirk, and I'm not sure that I've necessarily understood it, but you talk about Hampshire residents, and I wasn't sure where the boundary lies in terms of who funds things. Is it geographical in terms of your NHS source or your source? Because I would have thought that Hampshire residents should be supported by Hampshire County Council, dare I say it. But they don't appear to be, just because they have a GP in Portsmouth. I mean, you could be living over at Waterlooville or in towards Winchester and have a GP, in the city. But that doesn't mean you should be our responsibility as a social care. So how does the boundary thing work, or is it just cloudy?
It is cloudy necessarily, I think, because local authorities in the NHS operate on different boundaries. So for the local authority, if you're a resident of that local authority and putatively a council taxpayer, then and you have care needs, then the duty of care comes from us, in this case Portsmouth residents. For the NHS, it tends to be based on GP registration, so you're absolutely right. You could be living physically in the Hampshire area, but be the responsibility of the Portsmouth bit of the NHS. It can be difficult, and I think it can be difficult the other way around as well, because local authorities are so boundaried in that way. They can't spend their money on someone who isn't one of their residents. So if someone who lives in Hampshire but has a Portsmouth GP is staying in a unit in Portsmouth, the social care element of that is done through Hampshire County Council. The relationships aren't always the same between local authorities and their local NHS partners. The handoffs, as we call it colloquially, so that the process to get help in for somebody can be very different depending on the area of that local authority that person's living in. So it is a bit murky, it is a bit of a fudge, because the NHS and the local authority operate in such different ways.
Thanks. And just on that point, having managed a service until recently which had the criteria of living in the city or a GP in the city, but of course that includes Crookhorn, which is outside the city because it's part of Portsdown Group practice and therefore counts as a Portsmouth surgery. It causes huge amounts of issues when you're trying to work across, when in one area you've got someone who's supported by the NHS, the community NHS services in one area, and then is responsible for the responsibility of people of social care for the other area, and vice versa, because we do have some people, of course, who live in the city who have their GPs in Porchester and even in Havant as well. So it's one of the ones I have a large amount of experience of the understanding and experiencing that complexity. And as Andy said, I mean, I don't think we've had too many recently, but I know in the past, for social care, for example, we've had quite a few battles about who's responsible for funding who, because when someone lived in Portsmouth for a long enough time, and therefore they become our responsibility, or vice versa with Hampshire, and that's been something that we've had, that we do have as an ongoing issue, not, as I say, fortunately not too much recently, but funding is always an issue. And of course, who's responsible for funding? Is it a community? Is it a continuing healthcare funding and therefore the NHS, or is it something that the local authority has to do? And that's what keeps people like Simon and Andy very busy. And of course, Louise, making sure they put the finance point of view through as well. Just a couple of bits from me, Andy and Simon. Andy, obviously this is, Andy, I'll come to you in particular for this. This is obviously about D2A here. We've learnt from Lewis about how we are known around the country. What is the situation elsewhere in Hampshire and Isle of Wight, for example, in D2A?
So it is mixed. At the moment, I think we're talking about 4 weeks across the board in terms of funding. Simon might correct me on that one.
Yeah, so Hampshire and other places in Hampshire and Isle of Wight use their hospital discharge programme to buy beds and to enable their D2A services to run through. From April, that all disappeared. They reverted back to assessing in the hospital for complex placements. So they don't do that 4 week period like we do currently, which has led to some of the performance discrepancies, which if you have a look, Hampshire's medically optimised for discharge numbers increased rapidly from April earlier on this year. So it's not an equitable service around the Portsmouth hospital footprint, which is in itself an issue. So they aren't doing that. Southampton are very close. They're doing 4 weeks in Southampton, but they are very close to moving to the Hampshire situation in terms of more assessments in hospital. And if we use up all of our funding, and if we don't secure any more, then we'll be in exactly the same position, risk of having to go back to assessing to discharge.
Thanks. Yeah, and I think that's the real issue. I mean, coming back to Graham's point there about the funding, because and this is obviously something we've been aware of for a while in terms of the danger that's there is that if the funding runs out, then we're back to assess the discharge, which isn't obviously discharge to assess. So and that's a real concern, and if we, as we have a model that works, we have something that is known elsewhere, and then we're not able to run it anymore. Though, to be honest, if we're not able to run it, then probably no one else will be either. So as much as discharge to assess, which was, having been the cabinet member during the pandemic, was something that was so important at that, and actually something we talked at the time. I remember when it came in and we were all saying, actually, if we can keep this going post-pandemic, this would be absolutely outstanding because of the benefit it gives to the people involved. But it has to be properly funded. And of course, the beauty of it is it saves money as well. If you get people discharging them and assessing them in the right environment and then moving them out rather than being assessed in hospital, you're going to save a lot of money. And that's the real problem. And again, it's this endless thing that we have in local government, and which is central government, and this is where, we've had these discussions before. It's not about who the central government is. This goes back decades, where local government, it's just scratched from the table. It's just a bit here, a bit there. It's time limited funding. We don't have that thing. As I was at the myself and Andy were at the National Children's and Adult Services Conference, and I know Lewis has heard this before, but for your benefit, Graham is coming back in as spokesperson, and the chair of the LGA, who at that time was James Jameson, the Conservative, said in his keynote speech, I go to ministers every year and say, we want a 5-year funding plan for social care. We want 5 years of a guaranteed funding plan, so we can actually have a way we can deal with things and have that. And time again, and we all know this from local government, is central government just doesn't do that. It gives us, as we've got on here, one-off funding again. That's non-recurrent. We don't know how much we're going to get next time. We don't know what their funding, what the funding formula is going to be. We don't know anything like that, and it really puts things like this at risk. And Louise, just in terms of it's got about the 1.7 million. Can you just give us an idea of when that's awarded or when that award came in and sort of what it has to be spent on?
Yes, so the 1.7 that we're talking about is funds that the ICB have given us to support the external placements. So Simon alluded to the fact that we'd funded originally about 10, but we know we need more, and we're trying to understand what the permanent requirement is. Our thought process was 1.8 million, 1.7 million would be about enough, but currently it looks like we're running hot on that, and it's going to be more that is needed. So the 1.7 represents an additional investment from the ICB into external placements, but we don't yet have clarity on whether that's going to be recurring and what the final requirement is, but we're running hot currently on that 1.7.
Thank you.
No worries.
And on a lighter note, because I think we need to be a bit of a lighter note, Andy does mention, there's a little aside in there, that the Jubilee unit, until its renaming. So I would ask if we can have a conversation with our colleagues at the Jubilee unit and with our long-term idea of having it Arthur Conan Doyle related. So that'd be great. And it's been raised as it doesn't have to be Sherlock Holmes, so it can be any Arthur Conan Doyle. So I think one of them was, of course, he did The Lost World as well. So we could always have the Challenger units if we wanted to, for example. So there's plenty of things, but we're going to leave that up to the unit staff and residents. But it's something I think we've got we've got Mycroft Terrace, I think it's just happened somewhere in the city. So we're just trying to think of, it's something that I had a conversation about some time ago. We loads of Dickens stuff. Of course, we're very proud of Charles Dickens, but bearing in mind that Conan Doyle lived here, created Sherlock Holmes here, we have very, very little in terms of that, so it'd be a really good thing. Though I'm not sure if Baskerville Hall will be the preferred name for the units, or what was it, Reichenbach Towers, perhaps. But very happy to accept that report, and obviously we'll keep everyone updated on where we are with discharge to assess, and those conversations continue to go on both locally and nationally. I'm actually off to a healthcare integration seminar in London tomorrow, which will be very interesting, and it might I'll be really interested to see about what kind of, if there's any particular examples around D2A around the country. Well, it's southeastern London, but in that area, if anyone's got anything in particular, but whatever comes out there that's relevant to this, I'll happily report back. And just on that as well, as I mentioned at the briefing, I'll whenever we have the partnership boards that myself and Andy sit on the steering group, if we have the briefings after that, we'll our monthly update meetings, I'll feedback about that. I don't think, Graham, you were there at the last one, so I'll be reporting back on that on a regular basis, because it's obviously really important for everyone to understand how that's working with the within the integrated care system and how the integrated partnership is working there. So very happy to accept that report. Andy, over to you for meals delivery service.
Thank you. So the paper on the meals delivery service, we had, you'll recall, quite a lot of interest, public interest, when we had the issue of the provider withdrawing from the meals delivery service. We had an interim solution, then we moved over to Age UK Portsmouth. We then brought a summary of that involvement in the last municipal year. And so we committed to come back and bring an update around the meals delivery service, and that's the paper in front of you. So currently, since December of last calendar year, Age UK Portsmouth, local charity, have been providing that meal delivery service across all of our postcodes. It's important to state, I think, that this is under what they call a concession agreement, and therefore the service is designed to fund itself. There's no subsidy for this service, and it's not a statutory service in terms of something the council's supposed to provide, but we do provide support for it, administrative support, and keeping an eye on discussing with the provider. So on at the beginning of 2023, the service was running at a deficit, and we agreed to make a one-off payment to enable continuation of the service. The deficit was attributed to lower demand than had been anticipated, with a quicker ramp up over a wider postcode area, and so the charity has to break even. It's obviously a charity, it has limited reserves, and so we agreed it was in the interest of Portsmouth to make a one-off payment from our non-recurrent reserves to enable the charity to continue providing the meals. We then had a discussion with the charity, so this is at the base of the first page, moving into the second one, around increases in costs. I think we've commented for a long time about the cost of living impact that we've seen in the country, and that was particularly acute in food costs. So whilst we were talking about a give or take an inflation rate of around 10%, for food we were talking closer to 17%. Something that wasn't able to be foreseen when the charity took over running the contract. And so we all agreed that there needed to be a price increase to make it sustainable, and so that price rose from £7.23 to £8.50 a meal. And those people that are using the service, those residents using the service, were informed of that. Under Section 5, there's a sort of outline of the additional value that this service provides. It isn't just delivering a meal, it is ensuring that people are well. There's a great example of somebody who needed some support to get basics such as cutlery, bed linen, that sort of thing, and that was picked up through this service. But the value of a local charity is that network into other charitable provision and into other services that Age UK Portsmouth provide free of service at the point of use to residents. And we've had some positive feedback on the second paragraph in section 5 from those residents that are using this service to the drivers and to the charity. So in section 6, in next steps, we've seen in this first quarter that has just completed of this financial year, there's been a reduction in referrals in the customer base. And again, that's caused some problems for the charity. They're not suggesting at the moment that they're withdrawing from the service, but they are saying the numbers have dropped sufficiently that it's giving them some concerns. So what we're doing at the moment is working with them to understand where the service is advertised, whether there's any other opportunities for meal delivery that might help bolster the service and make it self-sustainable, and what forward plans we can have, why we think people are dropping out from the service, that sort of thing. This is something that this is the type of service we always wanted to get to because it's provided by a local charity, so it's not a national provider. The previous provider, their business model had vans that would run so that they heated the food as the vans ran, which in terms of climate was not a great idea. This is a locally provided service that uses a single kitchen, so we don't have that kind of that amount of pollution. This does provide additional value. We've got people being connected into other services when that meal delivery occurs, if that's what they need, if that's what they're asking for. So it's the type of service I think that we'd all want and that we want to sustain. Whether we can or not, we don't know at the moment, so we're still doing that work with the charity. And so we'll need to come back here to update you in due course as to when that starts to clarify. But it's still working. It's a service for a lot of residents in Portsmouth who value it. They value the contact they have with the drivers. And the charity themselves are very keen to maintain this service. So at the moment, it's working as it should be. We're seeing some added value, but we've got to make sure that it can be sustainable. I think is probably a reasonable summary of where we are. Happy to take any questions.
Thanks, Andy. Lewis or Graham? Lewis.
Just a question, then some comments. Just following on from what we've just been talking about, actually, in like the assessment process. Are we promoting it at that point as well, just to make sure it's getting to those people that are definitely, and is there an option for a short, I don't know how it works in terms of signing up, but is there a way of somebody signing up for a short period of time, for example, if they're in that assessment period, just to try and help bolster the numbers slightly?
Yeah, we no longer limit referrals through adult social care for the meals service, that anyone can make a referral in Portsmouth if they need to use that. And we've seen the charity be innovative. For example, I think they're supplying to one of the care homes in Portsmouth on a Sunday. So, doing that Sunday roast, they're advertising to carers who may want to have a day here or there off and get a meal provided. So there is flexibility within that service. And I think that one of the key things that we did was to remove the necessity to come through adult social care. We still need to think about the reach for advertising. Where's the most useful place to advertise that service? We do advertise it internally, so if somebody is having an assessment with us because of their needs, then that's an option for them if they need meals delivery. So it's trying to be as flexible and innovative as possible, I think.
Perfect, thank you on that. And then just to say, I think the benefit that we've seen from the wraparound and from actually this being delivered from a charity, like the stark improvement to residents has been phenomenal. So actually the pain that we went through has actually proven to be worth it, and we were on the right track and it was worth pursuing with. So well done all.
Thanks, Lewis. Graham?
Yeah, I want to go back a bit in history, actually. this always used to be called Meals on Wheels service, and I understand, if I'm correct, that there was always a contribution people gave towards the meals. And is it true that the local authorities generally made a bigger contribution towards its support, and this has been basically reducing over years because we had to make choices? Is that historically correct, or am I historically not correct?
I think I'd come back to your sort of word of murky, really. So the contract that was with a national supplier that finished in April 22, we had some debate about the year that this happened, it was April 22. The contribution that was made was for a reclamation of VAT, and so it wasn't an actual physical contribution from the local authority. The local authority was able to reclaim the VAT on the service and use that money. So for Portsmouth, in my memory, just trying to think, get this right, I don't think there's been any financial contribution from the local authority since about 2015-16. I'm stretching my memory. I couldn't give you documentary proof of that, but I think the arrangements will have been very different in different areas. So again, from my memory of other places in the county locally, we've had WRVS delivering it before Appetito, which is the national supplier that's in Hampshire currently, and I'm fairly sure the financial contributions have been fairly minimal. It's always been, not always, in recent history, it's been a service that needs to wash its face financially, if you like.
Yeah, I think going back to the early 2000s, I think probably we did make more of a contribution, but obviously that's a bit of ancient history now in many respects. The report makes clear that there's certainly going to be measures to try and increase the take-up, and you talk in paragraph 6, the first paragraph, about marketing support, etc. But you then go on to say the experience of the first quarter is actually not that good, because the first quarter of this financial year is not showing that. Now, obviously, we all hope that all the measures that have been put in place will increase the numbers of people who take up the meals and therefore help the viability of the service. But I note the current contract effectively runs over the next 2 financial years. It's 2024, but it's June 2024, so it runs until this financial year and then into the next financial year, although we are only a couple of months. You mentioned that the council has already given a small subsidy support, presumably for the last financial year, ending in April. What I wanted to ask was, and I know this is a political question or an officer question, is whether the administration would be willing to continue to support it, even if it did need a subsidy, at least until the end of the next financial year, which would take us through to March 2024. Because one of the problems for the voluntary sector is if we continue like this, it would help, I think, in planning for the future if we could give some sort of a guarantee that there was a guarantee of support until an X point, rather than having the possibility of this axe on the service hanging in the air for however long. Well, this month it's okay, or no, it's not going very well, or it's not. It's very unsettling for the people who deliver the service, and also for the people who receive the service, who may have anxiety. So I do think it's helpful if we could give some certainty. Obviously, the new contract will have to be decided as to whether it's a contract that is viable and deliverable, depending on the experience. But I'm just wondering if there can be any guarantee that at least until the end of this financial year, further support will be given if it was necessary.
I can't speak from an administration perspective. I can speak from a financial perspective. And Louise, my finance minder, can tell me if I get this wrong. So we don't currently have any allocation in the budget within this financial year. The money that we found that we've mentioned in the report was a non-recurrent pot from a non-recurrent reserve. And we felt it was reasonable that because the service didn't get the numbers when they first started up and ramped up quite quickly, we felt it was reasonable to pay that money over to make sure the charity could be stable going forward. I think certainly from the services perspective and financially at the time, we were very clear that it had to be a self-sustaining service because we didn't have the funds available to give any ongoing subsidy to it. So that's the factual account from a finance and service perspective, but I'll let Matt speak for the administration.
Thanks, Andy, and thanks, Graham, for the question. I think one of the things we have this ongoing issue with is with non-recurrent funding. It's where we can find things from underspends, we can find things where maybe we haven't, perhaps services has not had the uptake that we would like, and therefore we have something available. We have left over from certain grants we get that we have scope to use, and then we can, and as Andy said, I mean, I was quite happy last to have that money go forward because of the situation. Of course, they'd just taken it on. It's still a concept in process. Obviously, we did have the drop, which is a shame. But at the same time, you know, there are things in place, and we have a very good working relationship with Age UK Portsmouth as well. And certainly on a personal level, I know their chief exec very well, especially through her being the spokesperson for the voluntary community and social enterprise sector on the Health and Wellbeing board. She's also involved in other things and has been very proactive in things like the wider health and social care system in Hampshire Isle of Wight as well. So I think there's very much a willingness, and they've obviously come to various forums and fed back about it. But I think, and again, I'll speak as someone who very recently was working in the voluntary community social enterprise sector in the city. Non-recurrent funding is exactly what it is, and as long as that's made clear that that's what it is, that the people you're working with can take that into account, that they're not going to expect it to carry on. The issues are when you don't say it's non-recurrent funding and then you come up with it. I don't think, because we could well get to a situation if we were going to say now, oh, we'll give that money, but we don't have it, and we as we know in adult social care, we always have these particular spikes that come up, that maybe we suddenly have something where our overspend goes nuts through things we cannot envisage. And indeed, because as I said earlier, central government has this habit of bits of money, pots of money here, pots of money there, and we might not get one of these pots of money this year. We have to go on an assumption we do, but again, we do that because we have no choice. So I think the point is that we keep talking to Age UK Portsmouth. We do everything we can to support them in expanding the amount of people using it. These are freshly cooked meals compared to previously. These are freshly cooked meals which are done in the kitchens in Kingston Road. They're kept warm. They're sent straight out. They have that wraparound service, as has been mentioned. And I think that's the way we should do this. That we think this is a really good model. But what we've done with other things in the city is we reminded people, use it or lose it. And actually, perhaps we just need to make sure that individuals and organisations understand that if we don't get more people using it, it will not be sustainable. And if we get a non-sustainable thing, the point is if we ended up giving extra money towards this, and I'm not saying we wouldn't, but if we did do that, then you'd not be able to do it somewhere else. So I think having those conversations ongoing is the really important point. Then let's see where we are and let's see what the situation is growing. But I don't also want them to think, because also if you do it once again and then it's still not sustainable, then you might just end up doing it again and again and again, and therefore it just gets harder and harder as our budgets get more and more squeezed. So I be under no illusions, I and the rest of the administration want this to continue. But it's also got to be from the point of view of how's it going to fit in with AGK's finances in terms of does it do them any good to have ongoing non-recurrent funding? Because then they can't plan ahead either. Because if you say this is non-recurrent, well, you can do until the end of the financial year, and then you've got a hole again, and then it can just become a constant thing. So certainty is what they need, but certainty either way is probably a better thing for them rather than hanging a fig leaf where you think all this might happen. And in the VCSE, I have seen places go down because they've expected non-recurrent funding to come back, and then it hasn't, and they've gone out of business. Graham.
So that's a no to my question then.
It's not.
It's a long way of saying no.
It's not a no, Graham. It's a let's keep the conversation going and see where we are. At this point, I don't know what the benefit would be. As we said, we put this out as being something that is sustainable, and AGK Portsmouth have their entire thing was about this is a sustainable thing. We can see this being sustainable going forwards. But it is a case of let's see where we are. As we said, we just come to the end of quarter. Come to the end of quarter one. Let's see where we are. Let's do some more stuff, and maybe we'll revisit it at the end of quarter two and then see where things are, because by the time we've got there, and we have mentioned as well in the past that part of it might well be to do with the time of year as well, that it's when it's warmer, when it gets a bit cooler, that might have the intake. So and also, let's be clear, we don't know what the subsidy, if they did need some non-recurrent funding again, we don't know how much it would be.
It's okay. I mean, it doesn't provide the certainty that you said you wanted to provide. And I recognise what you're saying. You're saying it's a good service, but we still can't guarantee to be able to give it support until effectively the end of the contract. I mean, I think that's what they would like to know, at least till they've got it till the end of the contract. Obviously, the end of financial year is like really the end of the contract. But I hear your answer.
Thank you. Just something I was going to query, and I've lost my train of thought now. Yes, it was about the about what's going on in Hampshire, Andy.
As far as we're aware, the supplier in Hampshire is proposing to withdraw. I haven't seen that officially. I've heard that through other colleagues in Portsmouth who have spoken to colleagues in Hampshire, so I couldn't state that as I've seen this written, it's going to happen. But we understand that the supplier, who was the same supplier who was supplying us pre-April 22, is proposing to withdraw in Hampshire.
Thanks, Andy. And I think that just goes to show the difficulty in the sector at the moment. Thank you. So I think I'd like to recognise the report, very happy to accept it. The undertaking I will give is that we will do everything we can to support AGK Portsmouth in making sure that all the relevant organisations, some conversations we've already been having is about making sure that within the private social care sector that they are aware, the dom care in particular, that they can make that make their clients and their carers who are involved with them aware of the service to make sure that they can come in. We do recognise obviously the prices had to go up, but it's gone up by less than inflation, and is about the same as what Appetito pre-inflation rise, we're going to put it as last year, which is when we ended our contract, the contract with them, because we wouldn't accept that rise. Indeed, their rise now would be well over £10. So it'd be considerably more than AGK Portsmouth charging for better food and a better service. and we do want this to continue. So that is our commitment, is to support Age UK Portsmouth to get as many people using as possible, that we recognise and support their service for what it is and what it gives additionally, and try to make sure that we can find a way to make this sustainable. But that does mean as well that everyone in the sector has to be making referrals, has to be making people aware, and it is a potential use it or lose it, though we don't want to lose it. So happy to accept that report. That brings to the end of this today. Thank you very much, everyone.